Hey, this is Professor Rivera-Mitu. Welcome back to my channel. Before we dive into these practice questions on depressive disorders, make sure you've already watched our first video titled DSM-5 Depression Types You Must Know for the PMHNP boards, because that video covers all the diagnostic criteria, core features, and differences between types of depression. The questions in this video are designed to test your understanding of that content using realistic ANCC style scenarios with a strong clinical focus on DSM-5 TR criteria. Each question is followed by detailed rationales explaining why the correct answer is right and why the others are not. So stay with me through the whole video. Grab a notebook or open your notes app and let's see how many you can get right. Don't forget to like this video if it helps you, subscribe for more PMHNP board prep content and other nursing and allied health content, and share it with your study group. All right, let's jump in. A 28-year-old woman presents with a 3-week history of depressed mood, fatigue, hypersomnia, poor appetite, and anhedonia. She denies substance use, psychosis, or mania. This is her first depressive episode. She recently lost her job and reports feeling worthless. Which DSM-5 criterion must be met for a diagnosis of major depressive disorder? A. Depressive symptoms lasting at least 2 years. B. Symptoms are due to substance use or medical condition. C. Presence of at least 5 symptoms over a 2-week period. Or D. Elevated mood and decreased need for sleep. You can pause here if you need more time. And the correct answer is C. Presence of at least 5 symptoms over a 2-week period. This patient meets the DSM-5 criteria for MDD or major depressive disorder, which says that you have to have a presence of 5 or more symptoms for 2 weeks or greater, including either depressed mood or anhedonia. Option A refers to persistent depressive disorder. Option B incorrectly suggests secondary cause. Option D reflects mania, not depression. A 43-year-old man reports feeling down most days over the past 3 years. He has poor energy, low self-esteem, and trouble concentrating. No periods of full remission greater than 2 months. There's no psychosis or mania noted. Which feature distinguishes persistent depressive disorder from major depression? A. Suicidal ideation. B. Duration of symptoms. C. Psychotic features. Or D. Anhedonia. Pause here if you need to think. And the correct answer is B. Duration of symptoms. PDD requires at least 2 years of chronic depressive symptoms. It may present with fewer than 5 symptoms and no full remission lasting more than 2 months. Suicidal ideation and anhedonia can appear in both MDD and PDD. Psychotic features are not defining for PDD. A 24-year-old woman reports severe irritability, mood swings, and physical symptoms that occur consistently in the week before menstruation and resolve within days. Which of the following is required to confirm PMDD? A. 1 month of symptom observation. B. Symptoms that persist through the entire cycle. C. At least 5 symptoms during the luteal phase for most cycles in a year. And D. Symptoms caused by an underlying medical condition. You can pause here if you need more time to think. And the correct answer is C. PMDD diagnosis requires at least 5 symptoms that are mood-related and physical in the luteal phase, confirmed over 2 or more menstrual cycles. Symptoms resolve shortly after menstruation begins. Continuous symptoms, such as in B, are not diagnostics of PMDD. An 8-year-old boy exhibits severe temper outbursts more than 3 times per week for over a year. He is persistently irritable between outbursts. Symptoms occur at home and school. What is the most likely diagnosis? A. Oppositional defiant disorder. B. Pediatric bipolar disorder. C. Disruptive mood dysregulation disorder. Or D. Intermittent explosive disorder. Pause here if you need more time to think. And the correct answer is C. DMDD is characterized by chronic irritability and frequent temper outbursts, present for more than 12 months, starting before age 10. Bipolar involves distinct manic episodes, which are absent here. IED and ODD do not have the persistent irritability between outbursts. A 48-year-old man taking corticosteroids for lupus reports insomnia, fatigue, low mood, and hopelessness for 3 weeks. He started steroids 4 weeks ago, and he does not have any psych history. What is the most likely diagnosis? A. Adjustment disorder. B. Major depressive disorder. C. Substance or medication-induced depressive disorder. Or D. Bipolar II disorder. Pause here if you need more time. And the correct answer is C. Steroids are known to cause depressive symptoms. In this case, the temporal link and lack of personal or family psych history support a substance or medication-induced depressive disorder. A 65-year-old man with Parkinson's disease reports apathy, sadness, and low energy. The patient has no prior psychiatric history. What is the most appropriate diagnosis? A. Major depressive disorder. B. Adjustment disorder with depressed mood. C. Depressive disorder due to another medical condition. Or D. Persistent depressive disorder. Pause if you need more time. And the correct answer is C. Depression can result from neurodegenerative diseases like Parkinson's. When a direct physiological cause is known, the diagnosis is depressive disorder due to another medical condition. A 30-year-old woman has had depressive symptoms for 10 days, including fatigue, poor appetite, and difficulty concentrating. She does not meet full MDD criteria. What is the best DSM-5 classification? A. Persistent depressive disorder. B. Other specified depressive disorder. C. Adjustment disorder. Or D. Dysthymia. Pause here if you need more time. And the correct answer is B. This patient's symptoms are subthreshold for MDD and not stressor related. Other specified is used when criteria are almost met but duration severity falls short. Dysthymia and PDD require 2 years duration. A 37-year-old man has anhedonia, early morning awakening, psychomotor retardation, and weight loss. Which specifier best fits his depression? A. Atypical features. B. Melancholic features. C. Catatonic features. Or D. With anxious distress. Pause here if you need more time to think. And the correct answer is B. Melancholic features include anhedonia, diurnal mood variation, and vegetative symptoms. Atypical features involve mood reactivity. Catatonia requires motor immobility or stupor. A 52-year-old woman has sadness, sleep disturbance, and poor focus for 3 weeks following her divorce. She does not meet MDD criteria. What is the most appropriate diagnosis? A. Major depressive disorder. B. Adjustment disorder with depressed mood. C. Persistent depressive disorder. Or D. Other specified depressive disorder. I'll give you a couple of minutes to think. And the correct answer is B. Adjustment disorder requires emotional symptoms within 3 months of a specific stressor with subthreshold mood symptoms. This case does not meet MDD criteria and there's a clear psychosocial trigger. A 40-year-old male scores 17 on the PHQ-9. He denies suicidal intent, psychosis, or mania. What does this score indicate? A. Mild depressive symptoms. B. Moderate to severe depression. C. Subclinical depression. Or D. Adjustment disorder. Pause here if you need more time to think. And the correct answer is B. PHQ-9 score of 15 to 19 indicates moderately severe depression. This is significant and warrants treatment. Remember that in PHQ-9, mild is a score of 5 to 9, 10 to 14 is moderate, and 20 or higher is severe. The PHQ-9 is aligned with DSM-5 diagnostic criteria for depression. Thank you for watching. If you found this video helpful, please give it a thumbs up, subscribe to my channel, and share it with your fellow nursing students. Your support helps me reach more students and provide valuable content. Remember to subscribe to my channel to be the first to know about more test-taking strategies and concept map videos for different diseases. Remember, together we can make a difference in our nursing journey. Until next time, this is Professor Rivera-Mitu. Stay curious, stay compassionate, and keep learning. See you next time.